When people throw stones at you, you turn them into milestone. This is the saying of the great cricketer of this time. That is Sachin Tendulkar. He is really very neat and nice sportsman of this time. Now, formulations of the probiotics, these are available as tablets, chewable tablets, capsules, powders, sticks, and sachets. Probiotics taken orally can be destroyed by the acidic condition of the stomach, and to save this from the wrath of the stomach acid, microencapsulation techniques are used to solve this problem. Now, here one can see the tablets, the sachet, the stick, and the different formulation and different presentation of these probiotics like sachets and other. Now, multiple probiotics. These products have physiological effects of the multiple probiotic strains rather than a single strain being used as probiotic. So, number one is multibionta. It contains Lactobacillus gasseri plus bifidobacterium plus bifidobacterium longum. Number two is Acidophilus pearls that contains Lactobacillus acidophilus and bifidobacterium longum. Number three is Chiodophilus that contains Lactobacillus acidophilus plus Bifidobacterium bifidum and Bifidobacterium longum. The number fourth presentation is Simprove live attenuated probiotic. It contains Lactobacillus plantarum, Lactobacillus acidophilus, and Lactobacillus casei. Here one can see the multiple probiotics seen, and that is a multibiota probiotic multivitamin, Chiodophilus, pearls, acidophilus, and Simpro that contains more than one probiotics. Now, scientific guideline for the testing of the probiotic. Number one is probiotic must be alive when administered. Viability and the reproducibility on a large scale and stability during use and storage. Ability to survive in stomach acids and then in intestinal ecosystem. Number B is document to prove health benefits in target hosts. Products that contain live organism reproducible cause health benefit is probiotic. There are difficulty like variability in site for the probiotic use, that is oral, vaginal, and intestinal, and the mode of the application of probiotics. C. Probiotics define microbes or the combination of the microbes, genus, species, and strain level. As most effects of the probiotics are strain specific, this calls for a precise identification of the strain, that is genotypic and phenotypic character of the organism. And D is probiotic must be safe for their intended use. Safety of the potential probiotics assessed by minimum required test like determination of the antibiotic resistance patterns, certain metabolic activities, side effects in a human, adverse incidents in the consumers. These are all one have to consider. Strain under evaluation produce toxins in mammals, any known hemolytic potential. Now, types of the probiotics. Mainly two groups of the bacteria and one yeast is mostly used as probiotic. Number A is lactobacillus, most common probiotic present in the yogurt and other fermented foods. It helped diarrhea and helped people unable to digest lactose. So, in case of lactose intolerance, that is being used. It is anti carcinogenic, also help to treat acne and canker sores. Strains used are Lactobacillus acidophilus, Lactobacillus casei, Lactobacillus delbrueckii, Lactobacillus plantarum, and Lactobacillus brevis. The other type is Bifidobacterium. It is found in some dairy products, digest oligosaccharides from breast milk, also help dental cavities. Strains used are Bifidobacterium adolescentis, Bifidobacterium longum, Bifidobacterium brevi, Bifidobacterium bifidum, and Bifidobacterium infantis. And the third type is Saccharomyces boulardii, that is a yeast found in the probiotics. It fights diarrhea and the other digestive problem. Now, the types of the probiotics. Other variety is Streptococcus salivarius, Lactococcus lactis, Enterococcus faecium, Leuconostoc, Mesenteritis, Propionibacterium, Fruden ricci, and the Pediococcus acidilactici. Now, these are the probiotics, as one can see, Bulgaricus and Propionibacterium, Streptococcus thermophilus, and Bifidobacterium, Lactobacillus, and Lactococcus. These are the different probiotics, and that is their shape and appearance and the morphology. So, here is the island in the sea which have been given the shape of the heart by very artistically growing the plants on the land inside the sea and giving the appearance of the heart in the sea. It's really beautiful and skillfully done. Now, side effects of the probiotics. Though probiotics are safe but have side effects in people with immunodeficiency, short bowel syndrome, central venous catheters, cardiac valve disease, and premature infants are all prone to have the side effects. The inflammatory bowel disease, viable bacteria from the gut can pass to the internal organs, that is called bacterial translocation. In bacteremia, probiotic used by the children with low immunity results in the bacteremia or the fungemia, because these activate and becomes active microorganisms. Bacteria or the fungi in blood lead to a sepsis, which is a very fatal disease. Now, continuing the side effects, lactobacillus species cause obesity in the humans. Mild side effects are stomach upset, diarrhea, gas, bloating, and abdominal pain, skin rash, fever, bloody stool, etc. They may trigger allergic reactions, sometimes interact with the immunosuppressive drugs, leading to the life-threatening conditions, as they do not allow the life-saving drug to affect. So the people taking such drugs should avoid it. Now, proteobiotics. Proteobiotics are the natural metabolites produced by the fermentation of the specific probiotic strains. These are proteobiotics. These small oligopeptides were isolated from the culture media used to grow probiotic bacteria. Scientifically advanced probiotic products. The other product is psychobiotics. Psychobiotic, term used to refer to the live bacteria that, when ingested, might confer a mental health benefit. So the name is psychobiotics. Now, symbiotics. Symbiotics defined as combination of the prebiotics and the probiotics that promote synergistically gastrointestinal health, improved survival in upper GIT, and more efficient. So here one can see the probiotics when combined with the prebiotics that to lead to the formation of these two, that is symbiotics. Symbiotics, combination of probiotics and prebiotics. Postbiotics. Postbiotics, functional bioactive compounds generated during fermentation used to promote health. Immobilized probiotics, when ingested, exert positive biological response, work like probiotics. And when probiotics are not tolerated in pediatric population and immunocompromised patient, we do use the postbiotics. Now, probiotics summary: living microorganism with multiple mechanism of action, good safety profile, prevent and treat infectious diseases, an alternative to antibiotics in some situation, and may help to treat certain diseases like allergy, cancer, colitis, and IBS. So that is the end of the lecture. The probiotic mainly, but also prebiotic, postbiotics, and other family members of this family that have been discussed in detail, and hope so you may have liked this lecture. And if you have liked this lecture, please subscribe it and share it with the others. And if you have any question, please feel free to ask me. And thank you very much for watching